Did you know that we unknowingly harm our kidneys every day by taking medication incorrectly? Our kidneys, though small, play a vital role in our survival and are silently suffering damage from seemingly harmless medications. Today, Interesting Knowledge 368 will help you discover 7 common medications that can harm your kidneys. Knowing this will help you avoid these risks and protect your health and the health of your family. Watch the video until the end to learn how to protect your kidneys starting today. 1. Antibiotics. Antibiotics are a widely used group of medications for treating bacterial infections. While they are crucial for controlling infections, some types of antibiotics can cause kidney toxicity, nephrotoxicity, leading to acute or chronic kidney damage. Certain antibiotics carry a higher risk of causing kidney damage. These include aminoglycosides, such as gentamicin, tobramycin, and amikacin, which are known to have the highest risk of kidney toxicity. They can accumulate in kidney tubule cells, causing damage and cell death. Vancomycin, often used to treat serious infections caused by gram-positive bacteria, can also increase the risk of kidney damage when used in high doses or in combination with aminoglycosides. Polymyxins, such as colistin, used for treating infections caused by drug-resistant gram-negative bacteria, can also cause kidney damage. While cephalosporins and penicillins have a lower risk, they can still cause interstitial nephritis in some cases. Antibiotics can sometimes cause kidney damage, which can occur in a few different ways. One way is through acute tubular necrosis, where the antibiotic accumulates in the kidney tubules, damaging the cell membranes and internal structures. This can lead to cell death and a decline in the kidney's filtering function. Another way is through acute interstitial nephritis, an allergic reaction to the antibiotic that causes inflammation and swelling in the kidney's interstitial tissue, resulting in a sudden decrease in kidney function. Some antibiotics can also affect blood flow, reducing blood and oxygen supply to the kidneys, causing damage due to lack of blood flow. Certain factors can increase the risk of antibiotic-induced kidney damage. These include advanced age, as kidney function naturally declines with age, increasing the risk of drug accumulation. Pre-existing kidney disease makes patients more susceptible to further damage. Dehydration or low blood volume can also increase drug concentration in the blood. Using antibiotics along with other nephrotoxic drugs, such as NSAIDs or diuretics, can also contribute to kidney damage. High doses and prolonged treatment durations can lead to drug accumulation in the kidneys. Symptoms of antibiotic-induced kidney damage include decreased or absent urine production, swelling in the face, hands, and feet, fatigue and weakness due to toxin buildup, nausea and vomiting, difficulty breathing due to fluid buildup, and sudden high blood pressure. Using antibiotics wisely is crucial for your health. Here's how to ensure you're using them safely and effectively. Use antibiotics only when prescribed. They are specifically designed to fight bacterial infections. Avoid using them for viral illnesses. Adjust the dosage. Your doctor will determine the appropriate dosage based on your kidney function, which is assessed through blood creatinine levels and glomerular filtration rate. If you have kidney problems, your dosage may need to be reduced or the time between doses extended. Monitor your kidney function. Regular blood and urine tests are essential to track your kidney health. If possible, your doctor may also monitor antibiotic levels in your blood, especially for medications like aminoglycosides and vancomycin. Avoid combining medications that can harm your kidneys. Be cautious about taking other medications that could potentially damage your kidneys. Stay hydrated. Drinking plenty of fluids helps your kidneys eliminate medications effectively. This is especially important for older adults or those at risk of dehydration. Educate yourself. Learn about the warning signs of kidney damage and report any unusual symptoms to your doctor immediately. 2. NSAIDs. NSAIDs are a common group of medications often used to relieve pain, reduce fever, and combat inflammation. While they can quickly alleviate discomfort, using NSAIDs improperly or for extended periods can potentially damage the kidneys. NSAIDs work by inhibiting the cyclooxygenase, COX enzyme, specifically COX-1 and COX-2. These enzymes play important roles in the body. COX-1 helps protect the stomach lining, regulates blood flow to the kidneys, and assists in maintaining fluid and electrolyte balance. COX-2 is involved in inflammation and pain. When NSAIDs inhibit COX, they reduce the production of prostaglandins, which help dilate blood vessels in the kidneys. This can decrease blood flow to the kidneys, especially in situations of dehydration, stress, or pre-existing kidney conditions. NSAIDs can cause kidney damage in a few ways. Acute kidney injury, AKI. NSAIDs can reduce prostaglandins, which causes blood vessels to constrict, leading to decreased blood flow to the kidneys. This can result in damage to the kidney tubules or an inadequate blood supply. Acute interstitial nephritis, AIN. This is an allergic reaction to NSAIDs that causes inflammation in the kidney tissue, impairing kidney function. Acute tubular necrosis, ATN. This occurs in patients who take high doses of NSAIDs for extended periods. It causes cell death in the kidney tubules, severely affecting the kidney's ability to filter blood. Chronic kidney disease, CKD. Continuous long-term use of NSAIDs can lead to irreversible kidney damage. This can cause scarring and permanent damage to the kidney tissues. Older adults. As people age, their kidney function naturally declines, making them more susceptible to the effects of NSAIDs. Dehydration or reduced blood volume. These conditions increase the risk of decreased blood flow to the kidneys. Pre-existing kidney disease. Individuals with chronic kidney disease, CKD, are more vulnerable to kidney damage. Other underlying conditions: heart failure, liver disease, cirrhosis, hepatitis, and uncontrolled high blood pressure. High and prolonged doses. This is common when medications are used without a doctor's guidance. Combination with other medications. Diuretics, ACE inhibitors, and antibiotics with the potential for kidney toxicity. Acute kidney failure can manifest with symptoms such as decreased urine output or complete lack of urination, swelling in the face, hands and feet, nausea, fatigue, back pain, and sudden high blood pressure. Chronic kidney failure, on the other hand, can lead to persistent fatigue, overall decline in health, frequent swelling, elevated creatinine levels in the blood, and high potassium levels, hyperkalemia, which can increase the risk of irregular heartbeat. Use NSAIDs only when necessary. Only use NSAIDs when explicitly prescribed by your doctor. Do not self-medicate for mild symptoms. Adjust dosage. Dosage should be adjusted based on individual kidney function, GFR, and serum creatinine levels. Use the lowest effective dose for the shortest possible duration. Stay hydrated. Drink plenty of fluids while taking NSAIDs, especially if you are dehydrated, such as after exercise or fever. Avoid long-term use. Avoid continuous use of NSAIDs for extended periods without medical supervision. If chronic pain relief is needed, consider alternative methods such as paracetamol or less toxic alternatives. Monitor kidney function. Have regular blood and urine tests to check creatinine levels, GFR, and proteinuria. This is especially important for high-risk patients, elderly individuals, those with pre-existing kidney disease. Combine with other measures. Use NSAIDs with stomach protectants, such as PPIs, if necessary. Discuss with your doctor about replacing NSAIDs with other pain relief methods. 3. Diuretics. Diuretics are a commonly used group of medications for treating conditions related to fluid retention, high blood pressure, heart failure, or chronic kidney disease. While they offer numerous benefits in reducing symptoms and supporting treatment, diuretics can negatively impact the kidneys if not used appropriately. Diuretic medications help your body eliminate excess water and salt through urine. This can help reduce fluid retention. This is beneficial for conditions such as heart failure, cirrhosis, or nephrotic syndrome. High blood pressure. By reducing the volume of circulating fluid, it lowers the pressure within blood vessels. Types of diuretics. Loop diuretics. Examples include furosemide, Lasix, and bumetanide. These are potent diuretics often used for severe edema or heart failure. Thiazide diuretics. Examples include hydrochlorothiazide, HCTZ, and chlorthalidone. They are effective in treating high blood pressure. Potassium-sparing diuretics. Examples include spironolactone and eplerenone. They cause less potassium loss and are often used for heart failure or nephrotic syndrome. Osmotic diuretics. Examples include mannitol. These are used in emergency situations, such as cerebral edema. Diuretics can have both positive and negative effects on the kidneys. On the positive side, they can help support kidney function in certain medical conditions by reducing the workload on the kidneys, controlling blood pressure. A major cause of chronic kidney damage, and reducing swelling by eliminating excess fluid in conditions causing fluid retention, thereby decreasing pressure on the circulatory system. However, if not used correctly, diuretics can harm the kidneys through various mechanisms. These include dehydration and electrolyte imbalance, as diuretics increase the excretion of water and electrolytes such as sodium, potassium, and magnesium. Severe dehydration can lead to decreased blood volume, reduced blood flow to the kidneys, and acute kidney failure. Hypokalemia, low potassium levels, is common with loop and thiazide diuretics. Low potassium can cause irregular heartbeat and impaired muscle function, including kidney muscles. Hyperkalemia, high potassium levels, can occur with potassium-sparing diuretics like spironolactone, especially in patients with kidney disease. This can be dangerous for the cardiovascular system and nervous system. Acute kidney failure can result from excessive fluid loss, leading to decreased blood flow to the kidneys and causing acute tubular necrosis. Diuretics can also increase the risk of kidney toxicity in patients already taking other nephrotoxic medications, such as NSAIDs or aminoglycoside antibiotics. High doses or prolonged use of diuretics can increase the risk of kidney damage due to several factors. Overuse of diuretics. This can lead to severe dehydration and electrolyte imbalance. Older adults, kidney function naturally declines with age, making them more susceptible to the effects of medication. Patients with chronic kidney disease, CKD, weakened kidneys are more vulnerable to damage when using diuretics. Combined use with other medications. Taking diuretics concurrently with NSAIDs or ACE inhibitors can increase the risk of kidney damage. Individuals prone to dehydration, patients experiencing diarrhea, vomiting, or inadequate fluid intake are at higher risk. Diuretic medications can sometimes cause kidney damage, leading to dehydration symptoms such as dry mouth, thirst, and dry skin. You may also experience dizziness, low blood pressure, and fainting. Electrolyte imbalances can occur, including low potassium levels, which can cause muscle cramps, weakness, and irregular heartbeat. High potassium levels can lead to a slow heart rate and an increased risk of cardiac arrest. Reduced kidney function may manifest as decreased urine output, recurrent swelling, and elevated creatinine levels in the blood. Using diuretics safely to protect your kidneys involves following your doctor's instructions carefully. Only take diuretics when prescribed by a doctor. Do not increase the dosage or extend the duration of treatment without consulting your doctor. Regularly monitor your kidney function by getting tests for creatinine, glomerular filtration rate, GFR, and electrolyte levels, potassium, sodium, magnesium. This is especially important for older adults or those with underlying medical conditions. Stay hydrated by drinking plenty of water, particularly in hot weather, or if you experience signs of dehydration. Avoid combining diuretics with other medications that can harm your kidneys. Discuss with your doctor if you are taking NSAIDs, ACE inhibitors, or antibiotics. If you are at high risk, your doctor may consider alternative treatments instead of diuretics. If you experience any unusual symptoms, such as dizziness, decreased urine output, or worsening swelling, stop taking the medication and contact your doctor immediately. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are a commonly prescribed group of medications used to treat conditions related to gastroesophageal reflux disease, peptic ulcers, and Zollinger-Ellison syndrome. While highly effective in reducing stomach acid and improving symptoms, PPIs can have serious effects on kidney function if misused or used long-term. Proton pump inhibitors, PPIs such as omeprazole, esomeprazole, lansoprazole, and pantoprazole work by blocking the hydrogen-potassium ATPase enzyme, also known as the proton pump in the stomach. This helps to reduce acid production, which in turn alleviates symptoms of heartburn and acid reflux and protects the stomach lining from damage. While generally considered safe for short-term use, proton pump inhibitors, PPIs, can potentially harm the kidneys through various mechanisms. Acute interstitial nephritis, AIN. This is an abnormal immune response to medication. PPIs are considered a leading cause of AIN in developed countries. The consequence is inflammation in the tissues between the kidney tubules, leading to reduced blood filtration capacity. If left undetected and untreated, it can result in acute kidney failure. Chronic kidney disease, CKD. Long-term use of PPIs has been linked to an increased risk of chronic kidney function decline. The mechanism involves untreated interstitial nephritis leading to kidney scarring, ultimately causing CKD. Acute kidney injury, AKI. In some cases, PPIs can reduce blood flow to the kidneys, causing ischemia and acute damage. Hypomagnesemia. PPIs can decrease magnesium absorption from the gut, leading to magnesium deficiency. This can result in irregular heartbeat, muscle spasms, and kidney damage due to electrolyte imbalance. Long-term use of proton pump inhibitors, PPIs, can increase the risk of kidney damage, particularly when used without a clear indication. Many patients self-medicate without being aware of the potential risks. Older adults are more susceptible to PPI-related kidney damage due to naturally declining kidney function. Individuals with pre-existing chronic kidney disease are at a higher risk of kidney injury. Combining PPIs with other medications such as NSAIDs, aminoglycoside antibiotics, or diuretics can further increase the risk of kidney damage. Regular monitoring of kidney function during PPI use is crucial to ensure early detection and management of any potential complications. Possible side effects of proton pump inhibitors (PPIs) on the kidneys include acute interstitial nephritis, which can manifest as fatigue, nausea, back pain, mild fever, rash, and joint pain due to an immune response. You may also experience decreased urine output, swelling, and chronic kidney disease, which can lead to persistent fatigue, a decline in overall health, recurrent swelling in the legs and ankles, high blood pressure, elevated creatinine levels, and low magnesium levels. Low magnesium levels can cause muscle spasms, cramps, irregular heartbeat, muscle weakness, and unusual fatigue. To protect your kidneys, it's important to use proton pump inhibitors, PPIs, safely. Only use them when prescribed by a doctor. Avoid long-term use for mild symptoms like heartburn without a diagnosis of GERD or gastritis. Use them for the shortest possible time, typically 4 to 8 weeks, unless your doctor advises otherwise. Regularly monitor your kidney function with blood tests, creatinine, GFR, and urine tests to check for potential kidney damage, especially if you are elderly or have a history of kidney disease. Monitor your blood magnesium levels and supplement if necessary, particularly if you experience low magnesium symptoms. Do not stop taking PPIs abruptly, as this can lead to acid rebound, worsening your symptoms. For long-term treatment, your doctor may consider switching to other medications like H2 blockers, ranitidine, famotidine, which have less impact on the kidneys. Combine medication with lifestyle changes to reduce reflux symptoms. Eat regular meals. Avoid late-night snacks. Avoid trigger foods like coffee, alcohol, spicy foods, and fatty foods. Elevate your head when sleeping, and manage your weight. 5. ACE inhibitors. ACE inhibitors, angiotensin-converting enzyme inhibitors, are a widely used group of medications for treating high blood pressure, heart failure, and chronic kidney disease, CKD. While they often provide benefits in protecting the cardiovascular system and improving blood flow to the kidneys, ACE inhibitors can cause kidney problems if not used correctly. ACE inhibitors, such as lisinopril, enalapril, and ramipril, work by blocking the angiotensin-converting enzyme, ACE. ACE is responsible for converting angiotensin 1 into angiotensin 2, a substance that constricts blood vessels, raises blood pressure, and increases pressure on the kidneys. By reducing the production of angiotensin 2, ACE inhibitors help to dilate blood vessels, lowering blood pressure, reduce the filtration pressure in the kidneys, and protect the kidneys from long-term damage in conditions like diabetes or high blood pressure. ACE inhibitors have a positive impact on kidney protection in patients with chronic kidney disease, CKD. They work by reducing pressure within the glomeruli, which helps to minimize the risk of kidney damage. They also reduce proteinuria, an early sign of kidney injury. Additionally, ACE inhibitors can help prevent the progression of diabetic kidney disease. Diabetes causes increased pressure within the glomeruli, leading to damage. ACE inhibitors help to lower this pressure. Finally, they improve blood flow to the kidneys, which is particularly important for patients with heart failure or high blood pressure. While ACE inhibitors offer numerous benefits, they can also have negative effects if used improperly or in high-risk patients. Acute kidney injury, AKI. ACE inhibitors lower pressure in the kidneys, potentially leading to decreased filtering function in some individuals, especially when blood flow to the kidneys is reduced. such as in dehydration or severe heart failure. Patients have bilateral renal artery stenosis, hyperkalemia, high potassium levels. ACE inhibitors reduce potassium excretion through the kidneys, which can cause hyperkalemia. This can lead to irregular heartbeats, potentially life-threatening. Decreased glomerular filtration rate, EGFR. A decrease in EGFR is common when starting ACE inhibitors due to reduced kidney pressure. In some patients, EGFR may decrease excessively, requiring dose adjustment or discontinuation of the medication. Drug interactions. Combining ACE inhibitors with diuretics or NSAIDs can lead to a triple whammy effect. NSAIDs reduce blood flow to the kidneys. Diuretics decrease blood volume. ACE inhibitors lower pressure in the kidneys. This combination can result in acute kidney injury. Certain factors can increase the risk of kidney damage in patients taking ACE inhibitors, especially those with underlying conditions. These include bilateral renal artery stenosis, narrowing of the arteries supplying the kidneys, severe heart failure, a weakened heart unable to pump blood effectively, end-stage chronic kidney disease, a significant decline in kidney function, dehydration or reduced blood volume. This can occur due to diarrhea, vomiting, or the use of diuretics. Advanced stage. Older adults often experience a natural decline in kidney function, making them more susceptible to complications. Concurrent use of other medications. This includes NSAIDs, diuretics, or medications that increase potassium levels in the blood. ACE inhibitors can sometimes cause kidney damage, which may lead to high potassium levels. Symptoms of high potassium levels include muscle weakness, fatigue, irregular heartbeat, and slow heart rate. You may also experience numbness or tingling in your hands and feet. In some cases, ACE inhibitors can cause acute kidney failure, which may lead to decreased urine output, swelling in the legs and hands, and sudden increases in blood pressure. While there are no obvious symptoms of a decline in estimated glomerular filtration rate, EGFR, it can be detected through regular blood tests. Before starting treatment with ACE inhibitors, it's important to have your kidney function checked. This includes tests like creatinine, blood urea nitrogen, and estimated glomerular filtration rate, EGFR. This is especially important for patients at high risk, such as those with kidney disease or renal artery stenosis. Your doctor may start you on a low dose and gradually increase it based on your response. Regular blood tests will help monitor your body's response to the medication. It's also crucial to monitor your potassium levels, especially if you're taking potassium-sparing diuretics like spironolactone, or have conditions that can increase potassium levels. Avoid combining ACE inhibitors with NSAIDs or diuretics without your doctor's supervision, as this can be dangerous. Stay hydrated by drinking plenty of fluids, especially in hot weather, or if you're prone to dehydration. If you experience severe dehydration or undergo major surgery, your doctor may temporarily stop your ACE inhibitor treatment. Regular kidney function checks, including blood and urine tests, are essential for early detection of any abnormalities. 6. Antiviral drugs. Antiviral drugs are medications used to treat illnesses caused by viruses, ranging from the common cold to serious conditions like HIV, hepatitis B/C, and COVID-19. While playing a crucial role in disease control and treatment, many antiviral drugs can affect kidney function, especially if not used correctly. Antiviral medications work by inhibiting the growth or replication of viruses within the body. Some medications directly destroy viruses, while others strengthen the immune system to fight against them. Short-term antiviral medications, direct action, such as oseltamivir, Tamiflu, for influenza and remdesivir for COVID-19, generally have a lower risk of directly damaging the kidneys. However, some, like remdesivir, can potentially reduce kidney function in certain patients. Long-term antiviral medications for chronic conditions, such as tenofovir, adafovir, hepatitis B, acyclovir, herpes, and foscarnet, HIV or CMV, cytomegalovirus, often have a higher potential for kidney toxicity, especially with prolonged use. HIV treatment medications, such as tenofovir disoproxil fumarate, TDF, can cause proximal tubular necrosis, leading to protein and electrolyte loss in the urine. Acute tubular necrosis, ATN, can be caused by certain antiviral medications such as tenofovir and acyclovir, which can accumulate in kidney tubule cells, leading to damage and cell death. Increased osmotic pressure from medications like acyclovir or foscarnet can create crystals in the kidney tubules, causing blockages and damage. Acute interstitial nephritis (AIN) is an immune response to medications that causes inflammation of the kidney's interstitial tissue. Some medications can reduce the kidney's ability to excrete potassium and acid, leading to electrolyte imbalances. Medications like remdesivir can affect kidney hemodynamics, reducing the kidney's ability to filter blood. Patients with underlying kidney disease, such as chronic kidney disease (CKD) or a history of kidney failure, are more susceptible to potential harm. High doses or prolonged use, using the medication in high doses or for extended periods, increases the risk of drug accumulation in the kidneys. Dehydration. Dehydration can lead to higher drug concentrations in the blood and put additional strain on the kidneys. Concomitant use with other nephrotoxic medications. Examples include NSAIDs, diuretics, or aminoglycoside antibiotics. Advanced age. Older adults naturally experience a decline in kidney function, making them more vulnerable to potential harm when using antiviral medications. Acute kidney failure can manifest in several ways, including reduced urine output. This is a key indicator of kidney dysfunction. Swelling. You might notice swelling in your legs, hands, or face. Nausea and fatigue. These are common symptoms that can accompany kidney problems. Kidney stones. If you have kidney stones, you may experience lower back pain, pain in the kidney area, painful urination, and blood in your urine. Electrolyte imbalances. These can lead to various symptoms. Low potassium levels, muscle weakness and cramps. High potassium levels, irregular heartbeat and fatigue. Interstitial nephritis. This condition can cause mild fever, rash, joint pain, and muscle aches. Dosage adjustment. The medication dosage should be adjusted based on the patient's kidney function, using creatinine and eGFR. Kidney function monitoring. Regular blood creatinine, GFR, and urine tests are essential to detect early signs of kidney damage. Adequate hydration. Staying well hydrated is crucial, especially when taking medications that can form crystals, such as acyclovir and foscarnet. Avoiding kidney toxic combinations. Consult with your doctor to avoid simultaneous use with NSAIDs, diuretics, or nephrotoxic antibiotics. Using medication as prescribed. Do not adjust the dosage or duration of treatment without consulting your doctor. Monitoring for unusual symptoms. Immediately report any signs like decreased urine output, back pain, swelling, or unusual fatigue to your doctor. Medication substitution. In cases of high risk, your doctor may switch to less toxic medications or shorten the treatment duration. It is important to use antiviral medications only when necessary and with a clear prescription from your doctor. Regular kidney function tests are recommended, especially during prolonged treatment courses. Maintaining a healthy lifestyle, including drinking enough water and eating a balanced diet, can help support kidney function. 7. Lithium. Lithium is a mood stabilizer commonly used to treat bipolar disorder and other mental health conditions such as mania. It is one of the most effective treatments for managing mood swings and preventing relapses. However, long-term use of lithium can lead to serious side effects on the kidneys. Lithium works by regulating the transmission of ions within nerve cells, helping to balance brain chemistry and control mood. However, lithium is primarily eliminated through the kidneys, which can have a significant impact on kidney function if used long-term or at high doses. Lithium can potentially cause long-term damage to the structures of the kidneys, including the glomeruli and tubules. Prolonged use increases the risk of kidney fibrosis, which can lead to irreversible chronic kidney disease, CKD. Symptoms may include persistent fatigue, swelling, and decreased urine output. Elevated creatinine levels and a decline in glomerular filtration rate, GFR, may also occur. Lithium can affect how your kidneys respond to vasopressin, a hormone that helps your body retain water. This can lead to a decreased ability to concentrate urine, resulting in frequent urination, polyuria, excessive thirst, polydipsia, and chronic dehydration. You may notice you are urinating more than 3 liters per day, feel constantly thirsty, and have a dry mouth. Signs of dehydration include dry skin, dizziness, and low blood pressure. Lithium can build up in the kidneys at high levels, causing acute damage to the kidney tubules or glomeruli. This can lead to symptoms such as a sudden decrease in urine output, rapid swelling in the hands, feet, or face, and nausea or vomiting. Lithium affects the body's ability to balance water and electrolytes. This can lead to electrolyte imbalances, which may cause fatigue, muscle weakness, and irregular heartbeat. Chronic, irreversible damage to the kidneys can lead to complete kidney failure. As a result, patients may require dialysis or a kidney transplant. Dosage and duration of use. Using high doses or taking lithium for a long time can increase the risk of kidney damage. Underlying medical conditions. People with pre-existing kidney problems or diabetes are more susceptible to lithium-related kidney damage. Dehydration. Dehydration, caused by diarrhea, vomiting, or excessive sweating, can increase lithium levels in the blood. Drug interactions. Diuretics, NSAIDs, and other medications can increase lithium levels in the blood, leading to toxicity. Older adults. Older adults often have naturally declining kidney function, which increases the risk of lithium accumulation. Acute symptoms include decreased urine output, swelling, nausea, vomiting, and back pain. Sudden increases in blood pressure may also occur. Chronic symptoms include frequent urination throughout the day, constant thirst, and overall decline in health. Electrolyte imbalances can occur, such as hyponatremia, low sodium levels, which can cause muscle weakness, cramps, and irregular heartbeat. Hyperkalemia, high potassium levels, can increase the risk of heart failure. Before starting treatment, it's important to check your kidney function. This involves blood tests for creatinine and GFR, as well as a urine analysis. Regular monitoring is also crucial. Your doctor will check your kidney function and lithium levels in your blood periodically, usually every 3 to 6 months. The dosage may be adjusted based on these test results. Staying hydrated is essential, especially in hot weather or when you're dehydrated. Avoid using medications that can harm your kidneys, such as NSAIDs, diuretics, or drugs that increase lithium levels in your blood. It's important to be aware of the signs of kidney damage and report any unusual symptoms to your doctor immediately. If you experience kidney damage, your doctor may reduce your dosage or consider alternative treatments. Using lithium at the correct dosage is crucial for effective treatment. It's important to use the lowest effective dose to manage your condition. Regular monitoring of kidney function is essential, especially for patients on long-term lithium therapy or those with pre-existing kidney disease. Be mindful of potential risk factors, such as dehydration and drug interactions that can increase lithium levels. Your kidneys are silent organs, meaning they don't usually cause pain when they're experiencing problems. However, these problems can have serious consequences. Hopefully, this video has helped you understand the 7 types of medications that can harm your kidneys and how to use them safely. Remember to schedule regular health checkups and share this video with your loved ones to promote overall well-being. If you found this information helpful, please like and subscribe to the Interesting Knowledge 368 channel and turn on notifications to stay updated on important health knowledge. See you in the next video.